Hello everyone. I'm Dr. R.S. Puri, practicing in Janakpuri, New Delhi for the last 43 years. Today I want to talk about a very common problem, a cough that doesn't go away. Many people think cough is normal, but if a cough lasts for more than 8 weeks, it is called chronic cough and it should not be ignored. Let me explain some common reasons for long lasting cough through simple words. Number 1, asthma or allergy or pollution. In some people, cough is the main symptom of asthma. They may not have wheezing but still keep coughing, especially at night or at early morning. Number 2 is cough after infection. After cold, flu, or viral infections, the cough may continue for many weeks because the airways remain sensitive. Number 3 is acid reflux, that is GERD. Sometimes acid from the stomach comes up into the throat. This can cause frequent cough, throat irritation, or cough at night. Number 4 is smoking, active or passive. Smoking damages the lungs. Even staying around smokers can irritate the airways and cause long term cough. Number 5, lung or airway disease. Conditions like COPD, repeated infections, or other lung problems can also cause persistent cough. So, if your cough is lasting for more than 8 weeks, disturbing your sleep, or is associated with breathlessness, chest pain, fever, loss of appetite and weight, or blood in the sputum, please consult your doctor. Early diagnosis helps in correct treatment and faster relief. Thank you, and remember, long lasting cough always needs proper evaluation.